She's back, Paul.
All right. Good morning and good afternoon and good evening, depending on where you're located. Welcome to this important forum for us to discuss the effects of COVID-19 on the higher education sector. As we all know, this COVID-19 has brought a lot of challenges to countries, to communities, institutions, and obviously to individuals. None of us anticipated it, and certainly many of us were not prepared in dealing with the magnitude that have disrupted everything around the world: economies, health systems, and of course operations of institutions, including universities. We're very proud as the Alliance for African Partnership, and a consortium of various universities in Africa, together with Michigan State University, to be able to have conversations about the impact of COVID-19 on universities in particular. And today we'll set off the forum, which will of course continue over the next several weeks. We have 6 series that we have planned, and today is the opening one. And we are privileged that we'll have 4 leaders of universities around Africa who will be sharing their views with us. We have also received a series of questions from participants, and of course, participants will continue being able to contribute through the chat function, and there will be other questions that will enable us to have a robust conversation on various aspects of this COVID-19. So let me begin by introducing the participants that will be leading us, facilitating the discussion. In no particular order, Professor Barnabas Nawangwe, who is the Vice Chancellor of Makerere University, one of the oldest and premier universities in Africa. He's been Vice Chancellor since August 2017. Prior to that, he was Deputy Vice Chancellor, Dean and Principal of the College of Engineering, Head of the Department of Architecture, or at Makerere. His research interests are in the areas of vernacular architecture and sustainable human settlements. Professor Nawangwe has published more than 50 journal articles and is a co-author of the Encyclopedia of Vernacular Architecture of the world, and several books on architecture. He's a member of several international professional organizations and has overseen the academic and administrative transformation of Makerere University, including its transformation from a faculty-based to a collegiate university. The second person I'm privileged to introduce is Professor Ibrahima Diop, who is Professor of History and at the Faculty of Letters and Humanities, where he's at the Cheikh Anta Diop University, UCAD, in Dakar, Senegal, where he's also the Vice Chancellor. He specializes in West African history with a focus on the history of domination and their ideologies, African historiography, history of prisons and confinement, history of slavery in African societies, and the slave trade. He has more than 40 years of teaching experience from elementary to higher education, and he's trilingual in Wolof, French, and English, as we are going to see this morning, this afternoon, or this evening. And he's a member of the editorial boards, several editorial boards, as well as academic associations. The third person I'm privileged to introduce is Professor Rose Monya, who is the Vice Chancellor at Egerton University, one of our oldest universities. I'm saying ours because I'm based in Kenya. This is one of our oldest universities in Kenya, and the first female ever to join such ranks at that institution. She's now one of 4 female vice chancellors at public universities in Kenya, which means that we still have a long way to go in terms of gender equality at the highest levels of leadership in our public universities. In the 28 years that she has been at the institution, she has held various positions, among them founding director of the Center for Women Studies and Gender Analysis, and also chairperson of the Department of Agriculture and Home Economics. Later on, she rose to become the Dean of Students in 2007, and a year later, she was appointed the Deputy Vice Chancellor in charge of academic affairs, a position that she held until she assumed her current position. She has, of course, published extensively, and she's a member of important organizations, both locally, regionally, and internationally. She got her MSc and PhD in home economics at Iowa State University. The final presenter or facilitator is Professor David Norris from the University of Botswana. He holds a PhD in quantitative genetics and animal breeding from the Michigan State University. He read for his MSc in animal and forage science at the University of Reading in the United Kingdom, and he holds a BSc biology and physics from the University of Botswana. And he has, of course, participated in a lot of leadership training opportunities. He has had extensive experience as leader, researcher, and lecturer in different universities in Botswana, of course, the United States of America, and South Africa. Prior to joining the University of Botswana as Vice Chancellor, he was the Deputy Vice Chancellor responsible for research and innovation at the Botswana International University of Science and Technology. And before that, he was Director of the School of Agricultural and Environmental Sciences at the University of Limpopo in South Africa. Professor Norris, like his other colleagues have introduced, has published extensively in referred journals and conference proceedings. And of course, he has also supervised a lot of graduate students, both master's and PhD students, and served on various external examination as an external examiner for various regional and overseas universities. So please join me in welcoming our 4 presenters who are going to lead us in opening the discussions. Each one of them will have about 10 minutes to share with us their views on how the COVID-19 has impacted not only their institutions, but what they think as to what its impact has been on the higher education sector as a whole, and of course also some of the mitigation measures that they have taken and they think that universities should take in order for us not only to overcome this crisis, but also to ensure that we emerge from it maybe stronger than we have been. Before they talk, I think what the crisis has exposed are just a few things I'd like to share with you. One is, of course, it has exposed inequalities, within institutions, among institutions, within countries, in terms of capabilities of handling this crisis. And this is an issue that I think all of us have to think about seriously. It has also exposed, issues about infrastructural capacities for our universities. Some have been able to move almost seamlessly from in-person teaching and learning to using various online platforms. Others haven't been able to do so. So infrastructural issues are critical. And within that, of course, are the issues that have to do with access to gadgets, access to internet for faculty, for support staff, and of course, most importantly, for students. This has been, of course, a challenge all of us have to deal with. It has also exposed, I think, challenges with regards to preparedness to transition and to mitigate the effects of COVID-19, training of faculty, training of students. For those who are able to move online, that is an issue that has been exposed and that we have to deal with. And then it was also, I think, exposed challenges with regards to internationalization, from international collaborations to the international flow of students. Of course, a lot of students have had either to come back home, or they are unable to return to the countries where they were studying, or they're marooned in those countries and they are not on campuses. And there are all sorts of issues that has brought out. So the whole question of internationalization is one that I think has affected us. And of course, it has also exposed challenges with regards to research capabilities. Some universities have been able to participate very actively in biomedical research that is ongoing, in trying to develop treatments and so on and so forth. And then, of course, also research in terms of socio-economic, political, and other impacts on society that are critical for us to understand, and critical for governments to understand as they develop intervention measures to ensure that those interventions are appropriately anchored on the socio-economic, political, health capacities in specific countries, communities, and so on and so forth. So I think, in short, the crisis has not only, of course, affected the health of millions of people and economies and so on, but also posed challenges for universities to think through how we can participate in finding solutions, both in terms of the immediate, but also in terms of the long term. With those words, I'd like to invite Professor Nwange to start us off. He has about 10 minutes to share his views, and then we'll move to Professor Diop, and then Professor Monya, and finally, and of course, this is not by any means suggesting anything else, Professor Norris. So once again, welcome to this forum. Professor Nwange.
Thank you very much, Professor Zeleza. Good afternoon and good morning, all participants, and greetings from Makerere University. I want to thank the AAP for giving us the opportunity to share our response to the COVID-19 pandemic. Uganda has experienced several epidemics, including HIV/AIDS and Ebola, but COVID-19 still came as a shock and a new threat for us. When the president announced that we have to close, we closed immediately on 20th March, and all students were sent home, except for a few international students who could not travel because maybe there were no flights anymore to their countries, mainly because of that. But we are keeping them here, we are taking care of them on the main campus. We were not able to go online when this happened, full blast, although a few programs which are already online are continuing. And we are now discussing on how we move all our programs online, and we have put in place a task force to advise us on that. But let me share some of the responses that we came up with as a university. I hope that I'll be able to share my screen because there are some slides, and I hope that people can see.
Yes, we can see it.
Yes. So our responses were in three main areas. First of all, our graduate students and their supervisors in the medical school continued providing services at the hospitals, which we use as our teaching hospitals. So these are providing very critical service at a time of need, and we are very grateful that they accepted to do that. So we are sort of part of the front line in the fight against COVID-19 in that sense. The other interventions were in the area of research and innovations. Now, at the College of Health Sciences, and particularly the School of Public Health, a lot of research and studies are going on. And so I have put there that long list of research projects that are going on. One of them is development of a rapid diagnostic test. And then we we are trying to validate other non-WHO accredited tests for COVID-19. We are doing studies in immunity and the response and implications for future prevention of COVID-19 recurrence, as well as clinical management. We are studying chloroquine and hydroxychloroquine and other treatments. We are modeling COVID-19 epidemic in Uganda to inform planning and intervention mix over time. We are also studying environmental sampling for public health risk evaluation and a host of other studies really to understand the epidemiology and also to try and come up with the treatment protocols and diagnosis. So our colleagues are doing quite a bit of work in that area. As far as the innovations are concerned, I will talk about three major ones. The first one is the low-cost ventilator. As we all know, there is a huge shortage of ventilators around the world. And this has forced all of us around the world to begin looking for alternatives. So using the open design that we were given by our colleagues from the University of Florida, our researchers and engineers set to designing and sort of adapting it to our conditions, and they came up with a prototype. So on the slide here, you see the topology diagram of the proposed low-cost ventilator, and then the photograph of the first engineering test with dummy lungs. So this has been tested, and the engineering test has been successful. The next stage is testing on animals, and that is going on right now at our College of Veterinary Medicine, after which the ventilator will undergo some improvements in specifications depending on the results that we get from the tests on animals. Following that, we will be applying for certificates from the National Drug Authority and the other authorizing agencies in Uganda before we can apply the ventilator on patients. The next, but I should say first that our ventilator will be costing roughly just over $5,000 as compared to the ventilators on the market, which are between $25,000 and $60,000. So this will make the ventilators very much affordable for poor countries like ours. In Uganda, we have about 55 ventilators in the whole country, but we'll be able to make 100 of these the moment we have got the permission to continue. We will be able to make more than 100 in a very short time. And of course, then we can go on to mass production. The next is the EpiTent. The EpiTent is not new, but we have adopted it for the fight against COVID-19. The EpiTent was designed by our researchers and engineers during the outbreak of Ebola in West Africa. And we won a world competition to produce a tent that could be used as an isolation unit and also as a mobile hospital. This tent was successfully used for that purpose. We have now adopted it for the fight against COVID-19. It can work very well as an isolation unit because it controls humidity and temperature in our conditions very well, and it is very easy to clean both inside and outside, making it very suitable for control of communicable diseases. The government has bought into this, and they are ordering more than 100 of these so that they can be placed in areas where they are needed most. And we also have orders from the government of Ethiopia and the other places. So the EpiTent, which goes for a paltry 25,000 million Ugandan shillings, which is about, I would say, $7,000, is a very affordable innovation, and it is going to help us very much especially in isolation of patients, where we are unable, of course, to build specialized hospitals in a very short time. The last innovation that I want to talk about is the rapid testing kit. The testing kits are also on shortage all over the world. And yesterday, our Minister of Health was saying she orders and it takes time for her to get, and when she gets the supplies, they are always very few. Now, this rapid testing kit, which is also based in a unit where the scientists headed by one of our professors called Dr. Misaki Wayengera had already produced a rapid testing kit for Ebola, and it was successfully used in the DRC during the outbreak there. And so they are coming up with a rapid testing kit for coronavirus, which should make testing much more affordable. The cost of this kit will be less than $1, as opposed to $65, which we are using to buy test kits from abroad. The test kit will also reduce the time required for testing from 4 to 6 hours down to 10 to 15 minutes. And one other advantage is that with this test kit, you can test for coronavirus in any environment, in any setting, including very rural settings where there are no laboratories. And so people can be able even to self-test and know whether they have the virus or not. The kit is also undergoing tests, and we hope that the tests will be completed by the end of May, and we'll be able then to begin using this kit. Those are the innovations we have come up with, and we have said we are ready to collaborate. Several colleagues from around the continent and even beyond have been asking whether they could collaborate with us because they are also doing things similar to what we are doing. And we have said, yes, we are very open to collaborate on this because we are all dealing with a common enemy, coronavirus, which knows no borders. And we are very willing to share the knowledge that we have and to learn from the others what they have done, which probably we are not aware of or are not able to do right now. So that is the brief, Professor Zeleza, and I'll be happy to participate in the continuation of the dialogue. Thank you.
Thank you, Professor Nawangwe, and everybody I think would agree with me that it is really gratifying to see an African university really on the forefront of research, both biomedical research, but also research on the socio-economic impacts and the necessary interventions that need to be made. And I'm sure that all of us were quite impressed by some of the innovations that you have shared with us in terms of the low cost ventilator, the IP tent, and of course the rapid testing kit. I'm sure this is just the tip of the iceberg in terms of what your great university is doing at the moment. Let's now move on to Professor Ibrahima Diop, who can share with us what they're doing at Cheikh Anta Diop University in Dakar, Senegal. Professor?
Thank you so much, Paul, giving me the floor. I say hello to everybody. Good morning, good afternoon. And I have 10 minutes to tell you about the situation in UCAD, which is in the context of the first case was registered in Senegal by March 2nd. And in March 16, the decision was made at the governmental level to close the universities and schools and install the emergency state. And the district, the department, we call them here, it is Territorial Administrative Division. There are 45 in Senegal, and they were confined. You cannot travel from a department to another. And after the closing of the university, the student left overnight, and it was the horizon, the the date for comeback was for April 6th. But when we arrived at April 6th, we realized that the pandemic was expanding, and the new date is May 4th. But the horizon is sure that we will be postponed the coming back of the student after May 4th. And at the governmental level, the decision was made that we needed to continue teaching the student and continue to do our research. And the university was asked to find solution to deliver pedagogic resources in an accurate way and use the technology to get access to all the students. At UCAD, we had some meeting by online meetings with the top management. And our faculties, our school, our institute had different experiences in digital learning and online courses. Taking into account these differences, at the central level, we create platform for each institute, each faculty, and each school for adaptation. But the most critical question was the connectivity, the access for the student, because they are in all over Senegal. And as you know, maybe we are a big university that you can see that our students are around 75,000 students in 3 levels. And the staff, the faculty members are around more than 3,000 members. And the staff member 1,500. And we have this 3 level, and at each level, the number of students is very different. At the bachelor level is the most of the student, the number of students. And because of this situation of spread of the student overnight, we have, they cannot use the Wi-Fi at UCAD anymore. So this connectivity is a very critical question. But during the registration, the normal registration of students, we have their cell phone number. So we can send them SMS, text message, and we are in touch with all the students. And we ask all faculty, the decision was made that all faculty, all school, all institute have to join the student and set up to continue the teaching by delivering to the student on the platform the syllabus, pedagogic resources, and so have the feedback from the student. We use the union of the student who are well organized, and we have meetings with them to take the question of equity, equality between students. And we try to enhance the capacity of our direction of digital connection from specialized line of 8 giga to 15 giga. And in the first thing that we had to face is to keep safe our staff, our personnel. So we have in the university a medical and social welfare institute who is responsible for all health things in the university. They deliver communication on prevention against COVID-19 and deliver the procedure in case of symptoms appear or suspicious case. What is the required behavior of people facing cases of suspicious affection? And they produce posters that are spread in the university, because we continue working in the administration, in the technical and management. And we ask our staff who are using public transportation to stay at home. And we make in all the administration that the normal distance was respected. And we deliver to them masks and a solution of gel, alcohol gel to protect themselves. And that was for taking care of the healthy and safe our staff in the university. But for the society, we mobilize our socio-anthropologists who intervene in the press, in the newspaper, in social network, on internet, to help the government to make the most efficient communication, because we have a school of communication. In our faculty of science and technology, we were able to produce alcohol gel for the communities. And we deliver each day, we are able to produce 6,000 liters of hydrogel every day in our school, our Faculty of Science and Technology, in the School of Polytechnical School. And the students are mobilized in their communities where they are living to make easier for the student to get access to the courses and to help also the community to respect the recommendation made by the government and the medical personnel. And in UCAD, we have this, the Polytechnical School, who are able to produce hydrogel alcohol and some technological device, like, let's say, let me check. I hope that I will be able to share this for you. Okay, that is a device that created by the student at Polytechnical School. I don't know if you see it. It is a robot which is delivering food for the people who are infected. And this robot is a prototype, and it speaks Wolof, Pular, and French, and is able to deliver. That is the thing that our student created. And they are able, they create another device that can deliver gel without touching it, free hand. And at the Faculty of Medicine, which is one of the most oldest medicine faculty in Francophone University, and they are in the front line for taking care of the people who are infected. And we use very early the chloroquine solution. And since today, our staff, our faculty members in the medicine school is on the front line with their student. And the student at 5 and 6 level, over than 5 and 6 level in medicine, are mobilized in the hospitals and in the community to help the medical person. Even the historian, they are working to explain to people what was the experience for the epidemic, like in Spanish fever in 1918, the year our Faculty of Medicine was created. And they explained the experience of community involvement in communication. Also, we have our mathematicians who are mobilized to help for the modeling of the epidemic and its evolution. We have a radio in the campus, and this radio is also mobilized in the communication to invite experts, to invite qualified persons to talk to the student, and the radio cover 150 kilometers, and we are in internet, so we are able to join our student in communication. And also, our library was close to public, and we use our online library, and we give information to students that there is many library who is now free access, and they can use it for their learning. And we are planning for the coming back, because many kind of courses cannot be made. The internship, like the practical, what we call the TP in French, I don't know the word in English, that is small group working with their teachers in chemistry or in physics. And we said we cannot do it right now because lack of technical means. But when we come back in a normal situation, we will see how to handle it. But the main thing we learn from this is the necessity to develop online courses, the necessity to develop technology, and to have our students, our staff trained for this. We have some schools, some faculty who are very qualified in this, but some institute and some schools are on their beginning, and we will invest a lot. That is a decision made by the top management of the university after the experience of this. I will finish by a reflection on this experience, and that is my last word, is I would say a kind of philosophy, thinking what we learn from this pandemic. I think I just have to share this with you. I think you see the Angelus Nervis, Paul Klee painting, 1920. That is, we are on ruins, and the wind coming from paradise, we cannot stop it, and progress means ruin of everything we are doing. But this kind of progress, we need to change it, and to go in another one that I hope I will be able to share with you. I will be able to share with you to finish. It is difficult, this technology, that is to go from this Angelus to this Sankofa system, that I prefer this one. That is something I can elaborate more. That means for me, Africa has something to teach to other people to slow down. We are going too fast for human speed. And I think that we have philosophically to see if it is normal to go so fast and create lots of wealth in inequality and in people in discrepancy, and people are working hard and that develop maybe growth, sure, but inequality is too much developing at the same time. We have to think on this kind of, what kind of progress we need to share in the humanities. That is one lesson learned from this pandemic. I think that the president will excuse my too long time of presentation. English is not easy for me. Thank you so much.
Thank you, Professor Diop. That was a wonderful, wonderful presentation. I think we all benefited from learning what the university has been doing, after the closure of the campus in terms of going online. And I think you underscored some of the issues, given the sheer size of your university. It's one of the continent's oldest and largest universities, with over 75,000 students, more than 3,000 faculty and 1,500 employees, to think of all these communities, faculty, students, and staff, how they can be facilitated in making the transition to a new way of doing things. And you're sharing with us, trying to get feedback continuously from your constituencies, and of course, how to ensure the safety of the employees that have to continue providing essential services. And I think all of us were also delighted to learn from you what the university is doing intentionally to contribute to society in terms of interventions during this period. You mentioned some of the work that is being done by all the disciplines. I was delighted to hear what historians are doing. I'm a historian, and of course mathematicians, and you shared with us some of the innovations, the sanitizers, and of course the robot, and so on and so forth, that we as universities have a role to play in ensuring that we giving the kind of research, the kind of knowledge, and the kind of research that is essential for dealing with the current crisis, but also, as I said earlier, planning for the future. And I like the way you ended your presentation by noting that this crisis really forces us as human beings, as societies, as communities, as institutions, as individuals, to really rethink what progress really means. So thank you again. Let's now move on to Professor Monya.
Thank you very much. Following the directive by our Excellency, the President of Kenya, that the country needed to go on a lockdown, all learning institutions in Kenya got closed, and Egerton University closed on the 20th of March, 2020. All students went home except for the international students who could not travel since no flight was allowed in or to other countries. The pandemic made us realize that we had not made use of our College of Distance Learning, which is here at the university. We had not made the full capacity of it. However, the graduate school continued teaching master's and PhD students online. Mainly these particular areas were the limnology students, which are funded by the Austrian government, the CESAM, that is the Center for Excellence in Agriculture students, sponsored by the World Bank, and the TAGDEF students funded by the MasterCard Foundation. These had support from these sponsors, and it was easier to move on and take care of them the way we wanted. The university decided to contact KENET, that is the Kenya Education Network, to train our faculty online, which we have done. And thereafter, we now moved to our College of Distance Learning, which is now assisting the faculty, the teaching staff, on uploading, developing the courses and uploading them on the system ready for teaching. The faculties are also meeting to test how thesis defense can be done online. During this particular period, immediately it was announced that the pandemic was on. We had two departments which we thought were very pertinent to the development of cleanliness material. And the Department of Chemistry went very fast to develop for us the sanitizers, so that each department had a sanitizer to clean their hands. And also the section on tailoring, which is under the Department of Clothing and Textiles, also made for us the masks. Can you see this? So we didn't have a problem using them. Also the sanitizer, which is made by the Department of Chemistry. So in our own small way, we took care of ourselves, and our county is ready to collaborate with us so that we can be able to make more bottles of sanitizers and also the masks. Now, we have had a few challenges which need to come out. We have been teaching on face-to-face, and it is our concern that offering examination online is a big debate, which I think even the Vice Chancellors in Kenya are talking about. How do we mitigate security issues? It's a question that is giving us a little headache. Now, not all areas in Kenya has internet connectivity. We are an agricultural institution and the related. Reaching out to students from these areas is a big challenge. So that hampers our online training to the students. Some of the students from poor backgrounds are not able to afford internet connections, and this is also a concern. Operations in the university have been curtailed by lack of funds because we have been relying very much on fees from students, and we are very much hard hit with the absence of students. Now, it is difficult to work in full capacity since even field researchers, which we conduct a lot in the field, in the rural areas, we cannot be able to go out there because we cannot pass certain areas in the country because of the lockdown. And especially when we have sectional restrictions that we cannot go to certain areas like Nairobi, Mombasa, and the rest. And our experiments sometimes are in these areas. So that is a big challenge for us. Communication among staff, we have been so much used to face-to-face, but right now we have to go through talk through the phones, the emails, video conferencing, especially the Zoom, which Kenneth has taught us how to do. Now, lab work is also, and experimental work is also limiting since we have not perfected this online. We need to know how it can be done online. So far, we had only 11 courses online in the College of Distance Learning. But now, because of the pandemic, we are developing more courses to be able to be uploaded on the system. In my conclusion, I want to say that the lockdown is an eye-opener for innovators and technologies to make it easier for online instructions, especially in the agricultural-based institutions like ours and institutions which are very much practically oriented. The other thing which we need to find out is how to get back to normalcy with renewed strength and responsibilities among all actors. One of the problems which I'm foreseeing, even if we have to open because we have extended the lockdown, I am not very sure whether in the next 1 month we will be able to manage because our students come from all over the country and from all over the world. I'm not sure how we will come together and mingle. It's something I'm trying to figure out how it will be done. But I'm foreseeing a problem in the near future if we bring the students too early. And I think that is my conclusion. And I want to say thank you very much for bringing us together to talk about some of our concerns. Thank you. Thank you, Paul.
Thank you, Professor Monya, for, again, a very wonderful presentation, sharing with us the experiences of one of Kenya's great universities. You've shared with us what you had to do in terms of trying to use existing resources through your College of Distance Education, and how that college is helping you to develop more courses online, and of course training the faculty, but also the way you use existing national organizations such as the Kenya Education Network, KENET, that has been providing training for faculty across the country. I happen to be the chair of the Board of Trustees of KENET, and we are very, very proud of the way in which the organization and our universities have responded to training for faculty in order to use the new platforms that some of them may not have been familiar with. And we also heard how your university has mobilized to develop sanitizers, masks, all those things that are essential for the immediate health of not only your faculty as well as employees, staff employees, but also in terms of the community at large. And you shared with us some of the challenges that all of us are experiencing in one way or the other, and that we have to deal with: security issues, the question of gadgets and internet access for students, that particularly those in remote areas and from low-income backgrounds. Just for our visitors from outside Kenya, many of our universities are working with KENET, but also working with the telcos, as we call them here, Safaricom and Telcom, to provide cheaper bundles for students and faculty and staff for educational purposes. You also underscored, of course, the challenges of communication, and particularly challenges of lab and experimental work, given that many of our universities have those kinds of programs. And you ended by saying that this is really an eye-opener, which I take it to mean that, as you said rightly, what we do today will determine how we emerge out of it with perhaps greater strength, as well as responsibility as institutions that are very mindful, not only of our immediate educational mission for our students, but also as part and parcel of the transformation of our societies in making significant contributions to our communities and countries and the world at large. So Professor Monya, once again, thank you. Our last, but of course not least, presentation is from Professor David Norris, Vice Chancellor of the University of Botswana.
From the other universities. David Norris, as you already pointed out, I'm the Vice Chancellor, University of Botswana. Let me just indicate that we closed the university on the 1st of March. That is a day after the declaration of the state of emergency by the President. The President, His Excellency, Dr. Mokwetsi Masisi, declared the state of emergency on the 31st of March and indicated that the state of emergency will kick in from the 2nd of May, the 2nd of April, I must say. So a day before the state of emergency, we closed the university. Students left for their homes. But as my colleagues have already indicated, of course, international students could not go, so they remain on campus. And they're still on campus. We are taking care of them right here on campus. Now, I must just indicate that indeed, as the University of Botswana, we are largely a contact. I would say a contact. We do most of our teaching and learning on a classroom setting. So really what we do is really through contact with our students. We do have capabilities for going online, but the challenges have already been pointed out by my colleagues, which are quite an array of challenges, including connectivity in the rural areas, and the fact that there's also issues of inequality among students. There are those who have access to laptops, who have access to resources to be able to buy data, for instance, which would enable them to download all the online teaching and learning material. So these are all the issues that the university is actually now thinking about, to say, as we shall be moving, or as we intend moving into remote teaching and learning, how do we address those students who may not have the resources to be able to be taught online, or who may have the resources but residing in areas where there may not be internet connectivity? So we have a task team that is at this very moment proactively planning on what university could be doing in terms of developing different approaches to teaching. Because as I've already indicated, there'll obviously be different sets of students with different needs. And therefore, it would be crucial and ideal that we come up with different approaches through which we can continue the teaching and learning. We obviously would not be able to stop teaching and learning forever. As I indicated, we are largely conducting our teaching and learning through a classroom setting. But we now need to find other ways in which academic activities could resume. We met yesterday as university management to say we would want to resume the academic programs by mid-May. Now, if we are going to do so, what do we need to have in place? What arrangements do we have to have in place? What plans? And as I indicated, what is the form of teaching and learning that will take place? One of the things that I must indicate is that one thing that we are considering is provision of laptops to all our students. We are in discussion with the sponsors to find out if our students, those who don't have laptops, if they could be provided with laptops that could be part of their, basically embedded in their tuition or scholarships. And then, of course, we are also talking to cell phone companies to really negotiate on discounted prices. And in some cases, even ask for 0 rating for students when they access education sites. So those are the discussions that we're having with the cell phone companies. This is very important if we are going to go online, because going online would need very basic things, as I've already stipulated, the laptops, the data usage, and so forth. And then, of course, we're also thinking of lecturers themselves, because some of them would have desktops that would be in their offices. Now, some of them would not have the laptops because they're only using the desktops that are in the offices. The lecturers, we are thinking that we could even give them some soft loans where they can access, they can procure laptops and be able to conduct teaching and learning remotely. May I also indicate that there are those essential staff members that are still coming to the university for the university work to continue. We are in a period where we are admitting students. So a few of our staff members are still coming to campus. Most of our staff members who are coming to campus are really more from the medical side, the Faculty of Medicines, Faculty of Health Sciences, because these are our professionals who are providing healthcare at the teaching hospital. Now, this brings me to what the university is doing in terms of assisting ourselves and assisting government in mitigating against this COVID pandemic. There are a number of things that the university is doing. But first of all, it is the provision of clinical care. We have a faculty of medicine which has resident skills. We have specialist nurses, we have pharmacists, we have critical care specialists, we have emergency physicians. All these professionals are actively, as we speak, in the teaching hospital, taking care of patients. We also have some of our medical staff, not only at the teaching hospital, we have them spread all over the country in a number of referral hospitals in Botswana. The other issue that we found very, very important that the university could address and assist in is provision of psychosocial care, because there's a time where there's a lot of stress. There's a lot of stress for those who are in quarantines. There's a lot of stress for those who have contracted the virus. There's a lot of stress for those who give care, the medical staff. So psychosocial care becomes very, very important. We have specialists, we have psychologists, we have our social workers who are working very, very closely with government teams from the local government, from the Ministry of Health. We're working together very, very closely with other stakeholders in providing all these services that I've already pointed out. And then, of course, we are also very much active in trying to find some innovations that can also address some of these issues. My colleagues have pointed out some of the innovations, some of which are also common with us. We have produced, or we are producing, sanitizers. I don't know whether you'll be able to see this, a sanitizer that is produced from our pharmacy department, Department of Health Sciences, the Faculty of Health Sciences. Some of these sanitizers we've been donating to the hospitals. We've also produced face shields. These are some of the things that are produced in our labs. We just donated, I think, 100 to the hospital, and we'll be mass producing some of these things. We are also working on what you call these hoods that are used in the hospital, the masks and so forth. We are prototyping on a ventilator. We're actively prototyping on a ventilator, and there's a collaborative work between ourselves, our sister institution called Botswana International University of Science and Technology, BITRI, which is another innovation center, and this is also done in collaboration with industry. As I pointed out, the other one which I mentioned, I think, is what you call the ventilator hood. In terms of research, we have our scientists from the biological sciences, from chemistry, from health sciences, who are exploring extraction of medicines from indigenous plants that have been used traditionally as inhalants to open chest airways. Now, this research is on medicinal plants such as aromatic plants that have been historically wrapped on the chest to aid breathing. The testing of COVID, or testing for COVID, is also very, very important. The university is collaborating, our Department of Biological Sciences are working closely with the Botswana Harvard Partnership, the Botswana National Health Lab, to increase our capacity of testing. The goal is to have at least 3,000 tests per day. Advisory services are also very, very important. Most of our professionals that are working in different government task teams in the areas of economics and many other areas which require advisory services. And then, of course, the other important one is the work that we've done with the Ministry of Health. We have produced at the university a dashboard for monitoring the COVID-19 epidemic. Basically, we have developed some three computer software tools for the management and monitoring of COVID-19. So these are just some of the things that the university is actively doing. But let me just say before I stop to say that I think though we may say this has posed a lot of challenges for us, it has also opened our eyes. I think there are great opportunities or great lessons that are coming out of this challenge. One major thing is that the era where universities stand there alone is normal. I think universities really have to be at the center of development. We must be at the forefront of finding solutions to societal challenges. Working closely with the ministries, working closely with governments, with industry is critical. It has to be a norm for us. And I think what is also very important, which is a good lesson, is that self-reliance for us is very, very important. We cannot be relying on people or on other nations to find solutions for us, to come to our aid. We must find solutions for ourselves. We must be self-reliant in many areas, in many, many areas. Thank you very much.
Thank you, Professor Norris, again, for a very, very wonderful presentation, sharing with us the experiences, activities, initiatives, innovations of your great university, University of Botswana. He shared with us, the challenges of dealing with international students, ensuring that we protect them. And many of our universities, of course, have international students. On my own campus, we have international students from 74 countries. So this was one issue we had to deal with. And you have also indicated the various capabilities that you have been looking at to go fully online, and the issues that need to be handled, issues of gadgets for staff, faculty, and of course, most importantly for students, and issues of connectivity. They need to really plan and ensure that students have connectivity when they come back, and you're hoping, of course, that you resume in mid-May. So provision of laptops to our students, as we said, embedded in tuition or scholarships, trying to get discounted prices by the cell phone companies for connectivity is important, which, as I indicated, in Kenya, we are working on that. And of course, the work of essential services and how we work with our employees in those areas, make sure that they are protected, they're safeguarded, and of course, they are supported fully. And then finally, I think you shared with us very inspiring ideas about assisting society, assisting government, the ways in which your Faculty of Medicine is involved in clinical care, and very, very important, and some people have been asking on the chat, psychosocial support for not only your own constituencies, but for the society at large. As you rightly pointed out, this is a moment of stress for everybody. And of course, some people in the front line, in the medical field, are facing that stress at even higher levels. And of course, those who are in quarantine or whose relatives and family members are in that situation, there is stress. So that is gratifying to know that your university is working on that. And of course, like the other universities, the various innovations that you're doing, the sanitizers, the face shields, the masks, the prototype for ventilators, and then of course the research by some of your schools, particularly in STEM, incorporating indigenous medicinal plants in thinking about how some of these issues can be developed. The issue of developing dashboards to work with the ministries in terms of monitoring, testing for COVID, and of course, advisory services in other ways on various government task forces. All these are very impressive, and I think all of us can learn from you. I think where you ended is particularly critical for us to think about that, while this is a harrowing crisis, also embedded within it are opportunities. And we have a responsibility to try to seize any opportunity that we may want, that is possible, so that we come out of this crisis as institutions, as societies, much stronger, more resilient, more adaptable, more flexible, and that we as universities have to see ourselves as at the center of the development project for the continent. That means working with governments, the private sector, community organizations, others, and also to work with each other as institutions of higher education within our countries, across our regions, and obviously across the continent, and with partners also outside the continent. And the operative word, which of course President Nyerere popularized, is we have to go back to really thinking about self-reliance. Self-reliance doesn't mean being alone, but taking care of yourself, so that when you engage with others, you're not begging, you're not seeking aid, you are collaborating in terms of finding solutions that are useful for you, but also that other people can learn from. So those 4 presentations, I'm sure the participants will agree that have been really eye-opening. Certainly they have been eye-opening for me as a Vice Chancellor of the United States International University, in which we are dealing with all these issues in different ways, and we are facing similar challenges, and we're trying to do our best to learn from other institutions. So for me, I've been learning a lot, and I hope we'll continue learning. Now, what we'll do is to open up the conversation to questions that have been asked. As we were going through the presentations, people were posting a number of questions. Some of them have been answered in the process of making the presentations. But what I would encourage is that the presenters, as well as the organizers behind the scenes, can respond as much as possible to some of these questions, but also to inform the participants that some of those questions will be dealt with in greater detail in the 5 subsequent forums that we are planning. There are a number of questions that were already sort of identified, and I'll pose them to the facilitators or the presenters, and they may want to address them. Some of them they have already addressed in various ways, but they may want to give a particular emphasis. The first one is COVID-19 is seen as a game changer that is disrupting business as we know it. In that context, what innovative strategies can you recommend for integration of regional higher education to attract and retain students and build research capacities in sub-Saharan Africa? For me, I would actually not say sub-Saharan Africa, I would say Africa. So what are some of the strategies you think we need to be thinking about in terms of enhancing regional higher education to keep our students and to attract our students? We know a lot of African students go abroad. Maybe this is an opportunity for some of them to think seriously of learning in Africa, but also, of course, other students. So any of you can respond to that. And please, in the interest of time, let's give very quick responses. Yes, who wants to go first? Professor Norris, since you already, yes.
My colleagues, and probably even across the whole of the African continent, if we check our MOUs now, the memorandums of understanding that we have, you find that most of them are between ourselves and universities in Europe or in China or in Australia or wherever. We have very, very few memorandum of understanding amongst ourselves in Africa. This is the time when we need to have collaboration between ourselves in Africa. And I'm so glad that this AAP is really promoting this. It's very, very critical. Even in terms of students, we must promote our universities. Before this COVID lockdown, I was moving around African states, looking for students, African students, to come to my university. And I was also going to go to Europe, but tell those students in Europe that they can also come to our university. It's very, very important that our students not only think of rushing to other universities outside Africa and not taking our universities seriously. It starts with us, collaborating amongst ourselves. Thank you very much.
Yeah, I was saying, would any of the other three presenters want to add to that? If not, we can move on to other questions in the interest of time. Professor Ibrahima, please.
Yes, I think that what Vice Chancellor Norris is saying is very important, that we need to collaborate between African universities. Not only signing memorandum of understandings that I used to say sleeping memorandum of understanding, that we need programs. And we have to put the challenge on bodies like Codesria to move forward to make this collaboration. I think it is important to challenge African Union to the Department of Education to think about this collaboration. We have lots of resources that is available inside the continent and in the diaspora. And people of the diaspora is always willing to interact with the university in Africa. And if we develop digital learning, if we develop this new technology, it is possible to have Paul teaching in Dakar very easily, giving lectures, giving conferences and seminars. I think it is important. But we have to think about language barrier. I'm speaking in English. I feel easier in myself in French. So we have to think about this. If we look on this internationalization, I see that in UCAD we have 43 nationals. And in these 43 nationals, the Moroccan are the first. And the Gambian, which is inside our country, I would say, I can give some figures. From Guinea-Bissau, we have 20 students in UCAD, 20. And from Gambia, they are 18. But from Comor, we have 258 students from Comor, which is far away from Dakar. You see, the barrier of language is very important. We need to break it. And we have also to have a program of keeping our best students in the continent. What we do very often, I don't know in the other countries, that after the exams in the secondary schools, the best students are given international scholarship. So when they go outside, the most qualified students are making down the level of the, but if we give them a very important scholarship to our best students to stay in the country, that enhance the level of the classes we have in our local university. And they will live easier, because if you give them some amount, they go to France, to Belgium, it's not enough to study, to stay there. But if you give them the same amount of money, and also we have to think about the selfishness of our elites. Our elites are educating their children outside, and they let develop the inequality. And if they have their children in our system and use the means they spend for international education, we can reinforce our local system. That's, I think, about this question of integration and regional integration. Thank you.
Let me maybe move to other questions which the other presenters can address, but just to underscore the importance of mobilizing the African diaspora as an asset to the continent is absolutely critical. Some of us have returned from the diaspora to work on the continent, and many people circulate between the diaspora and Africa. Just for those who may not know, there is the Carnegie African Diaspora Fellowship Program that has been in existence for the last 7 years to facilitate mobility between African-born academics in Canada and the United States to come to African universities in a number of African countries. So I would like to encourage the African universities that are participating in this program, in this particular forum, and other areas to apply for these grants and fellowships, and also, of course, our colleagues in the diaspora to avail themselves. The program has been successful. We just launched the consortium for African diaspora scholars programs that will reach out to the diaspora in broad terms, not simply the African-born, but African Americans, Afro-British, Afro-Brazilians, Afro-French, you name it, to be able to participate in engaging the continent. And it will go beyond the countries that we are operating now in the Carnegie program to include the entire African continent, and also go beyond universities to work with various agencies that are in the knowledge production business, as well as that can benefit from policy development that is informed by data and research. The second question I would like to ask, and maybe we can give priority to our two colleagues who haven't addressed the first one. And the question is, the coronavirus pandemic appears to be a warning for African universities to strengthen their capacity in critical sectors such as health, women and youth empowerment, early warning preparedness, etc. What systems should be put in place to enhance higher education resiliency to pandemics and other stresses? Professor Nawangwe, perhaps you can, I see you were already ready to speak.
Yeah, yes. It is true that we have not had very much collaboration in the past, but we must also appreciate the enormous steps that have been taken to improve this. We have got some very successful examples like Ruforum. Ruforum has actually brought together a lot of universities to work together. And I will tell you that through the programs there, for example, at Makerere, we are training more than 20 people for PhD from the other African universities at no cost. And I think that is a very good example of the collaboration that is already going on. Then the Arua is another very good example where we are creating the Association for Research Universities of Africa. And we have said we are going to do research together in order to minimize costs and to have a bigger impact. So yes, we need to do more, but let us also be appreciative of the steps that have been taken already. Now, on the question of what African universities need to do in order to be more resilient in the face of pandemics, yes, it is true that we must strengthen our health. If a nation is not healthy, nothing else actually matters. Our nations remain healthy. And so we need to strengthen these faculties of health and all the other faculties that have something to do with health, because it is not necessarily the medical faculties alone that have an input in the health of the nation or in the health of the universities. And so putting in place more laboratories and probably using the method of sharing laboratories, because these labs are very expensive. If you want to have a very good equipment, it is very expensive. So through collaborations like Arua, Ruforum, in East Africa, we have got the Inter-University Council for East Africa, which brings us together, which as PhD students can actually travel from one university to another just to make use of equipment that is shared in universities. Of course, we need to enhance online learning. I have seen comments saying that we are just waking up. No, we have been having distance programs, but because there has been this traditional mode learning and teaching, which has been successful, we have not put very much emphasis on online education, distance education. Now we are realizing, even for our exploding population, that we need to access higher education. So yes, we need to do more. We need to build our laboratories. We need to train more people at PhD level to handle these issues.
Thank you. Perhaps we can now move to Professor Monya to address that question. Particularly how we also empower, youth, women, and so on, as we try to not only deal with this current crisis, but build resilience for our institutions. Professor Monya?
Thank you very much, Paul. First of all, I want to say it's very easy for women to get into institutions, whether in Africa or abroad. What I need to emphasize is that sponsors must be receptive to the African universities so that they are able to say, I want to sponsor this particular girl or woman to Egerton University, like what we are doing now. When you come to the Austria government that I talked about earlier, they are already sponsoring both men and women to Egerton University to study limnology. Then when we come to the World Bank, we have quite a number of men and women studying here at Egerton University, and they are being sponsored by the World Bank very comfortably. Then we talk about the MasterCard Foundation. They are sponsoring both men and women from different countries in Africa to come and study the different agricultural concepts within Egerton University. So I also want to say the sponsors have a great deal of work to play on sponsoring women and men into the African universities. The African Development Bank has sponsored both men and women here at Egerton University, and I haven't had any complaint. So I'm throwing this to the sponsors in one way or the other. The women, earlier on, women used to be afraid to go to other countries, but these days they do. The USAID has been very good in sponsoring men and women, both in Africa and also outside Africa. Now, to the resilience among African universities, particularly to the health sector, it starts with the individuals. The individual universities must put hygiene and health issues in the forefront. Like now, with me, I am seeing this pandemic as something that is really going to help us move forward by being first at our own level, being very hygienic in our own way of doing things, and making sure that the surrounding is clean enough. Otherwise, if we don't do that, even the health sector may not do much. So we must start with ourselves. And my background gives us that opportunity to do that. Thank you.
Thank you. We are coming to the end of our conversation. Of course, there are lots of issues to discuss, a lot of questions that we are all asking ourselves individually in our own institutions, and of course that have been asked through this particular forum. As I said at the beginning, we'll have opportunities to address some of the other issues that are being raised in greater detail in the subsequent forums. As I indicated, this is the first of 6 of such forums. The next one is going to be on how we catalyze dialogue and share research and innovative thinking around key issues in the age of COVID-19. And then the third will focus on increasing awareness of African universities as college, as knowledge brokers and leaders on the continent. The fourth one will be on how do we ensure that investment in universities post-COVID-19 is on the agenda of African governments, the private sector, and donors. So this will be an issue we'll look at in great detail. And then finally, we'll look collectively, share ideas on identifying funding opportunities that will support whatever activities our universities individually, but also collectively might want to pursue. I would like to thank the four presenters, which I presume all of you would agree with me, have been excellent. They have shared with us insights into their own experiences as universities, but also shared with us the interventions they have brought about in terms of dealing with the crisis in their own institutions, but also contributing to the national and regional and, dare I say, continental agenda and global agenda of trying to find mitigations for the crisis as it is now, but also to begin thinking about the future. As a historian, I can tell you, crisis, as Professor Diop mentioned, something like this happened in 1918 to 1920. The world did come out of that. The ones that did well are the ones not only those who managed the crisis properly, but were also able to put in place systems, structures, processes, and practices that they could use in the post-crisis environment. And we as universities have to do the same thing. And we have one thing that is fortunate for us as universities. We are first and foremost knowledge-producing institutions. We are thinking institutions. We are the ones that create knowledge, that disseminate knowledge through the teaching and learning of our students. And therefore, we are the institutions that should be at the forefront of understanding the crisis, the impact of the crisis, the multiple dimensions of the crisis, mitigation factors, mitigation forces and practices, but also what kind of world do we want to create in the future? And I think Professor Diop left us with an important philosophical question. What kind of progress do we want our countries, our societies, and the world to have so that it's a much better world after this crisis than it is now? A world characterized by more equality rather than the rampant inequalities and lack of access to basic resources, whether we are talking about healthcare, or we are talking about education, or we are talking about ability to participate meaningfully in community, national, and global affairs. With that, I want to thank all of you for your participation and look forward to engaging you in our series that will continue. And I would like now to ask Jose Jackson Malete, who is the organizer and her team from MSU and AAP, organizers of this very, very important and robust forum. Thank you very much.
Thank you very much, Professor Lesa. Indeed, this was a very inspiring dialogue session today. We'd like to thank the attendees that are participating. We had over 400 persons registering and close to about 300 at some point actually attending the session, and looks like from most of the continents around the world. I think it was very important for us to hear from African colleagues about how the universities are responding to COVID-19, the lessons learned, and the opportunities going forward. What is clear from what we've heard is that the responses were varied, but there are a lot of innovations taking place now around this COVID-19. And we hope that this continues, that there are problems that can be solved at home. You don't need someone to tell you what to do. You already know. However, we do need regional and international collaborations. And I'm hoping that what you have all been doing in your different universities can be shared with your neighbors, and of course, shared with the international community. It is of course clear that a lot of resources will be needed to mitigate some of these challenges. And so we look forward to hearing from you as you go forward in, post-COVID, how you have achieved some of this. There were a lot of questions on the chat around the private sector involvement. And while you are doing research and you're working together, how are you engaging with the private sector in getting these things commercialized is some of the issues. So thank you. We know that you're really very busy now, still responding to COVID-19 issues. So thank you for taking the time to be with us today. As we've said before, the next dialogue session is on May 13th, and it will be the same time. And the speakers will be Professor Steve Hansen, who is the Associate Provost and Dean from Michigan State University, Professor George Kanyama-Piri, who is the Vice Chancellor of Lilongwe University of Ag and Natural Resources in Malawi, Professor Charles Igwe, the Vice Chancellor from the University of Nigeria in Nsukka, and Professor Idrissa Traoré, the Vice Chancellor of the University of Arts and Human Sciences of Bamako in Mali. We are really looking forward to this important session. You've talked a lot about your research and what you're doing. We want to hear from you at this session now around how are you partnering and collaborating in these different areas. We will have other sessions coming up every 2 weeks. So keep track of this dialogue series. We'll be focusing on educational access, psychosocial support, food security issues, and then we will end with a public and private engagement session on how do we work together to manage COVID-19 going forward. So thank you all, and see you on the 13th. Thank you. Bye.
Bye-bye, everyone. Bye-bye. Thank you.
Thank you for sharing so well.
Thank you. Thank you.
Thank you. Okay.
All right. Excellent.
Okay. Thank you.
Justin, is there a way that we could silence